Hey everyone. Look, if you're gearing up for your CPC or CCS exams, you already know the molecular pathology section, codes 81161 through 81408, can honestly feel like you're trying to read an alien language. It is intimidating. But welcome to this explainer. Today, we're going to totally demystify this section using standard guideline navigation. We're going to master Tier 1 versus Tier 2 codes, and most importantly, I'm going to show you exactly how to dodge those super common exam traps. So let's jump right in. Before we get totally lost in the weeds of the CPT manual, let's just zoom out for a second. What are we actually coding for here? Well, at its absolute heart, molecular pathology is all about reading the body's ultimate instruction manual, right? Our DNA and RNA. These tests are literally incredible. They help doctors diagnose, treat, and even monitor all sorts of complex diseases. And your job as a coder, well, you have to translate all that amazing science into very specific CPT codes using strict pathology guidelines. So here is our game plan for today. Decoding molecular pathology, the golden rule, sequencing and modifiers, essential pathology vocabulary, and finally, the three-step decision tree. Starting right off with Section 1, Decoding Molecular Pathology, where we're getting our bearings with DNA and RNA. Okay, so when you're coding, these conditions basically fall into two main buckets. On one side, we've got germline conditions. Think of these as inherited genetic traits, stuff you're born with. And on the flip side, we have somatic conditions. Now, these are acquired changes, kind of like specific mutations you'd find in a tumor later in life. Your code selection in the CPT index hinges entirely on knowing which of these two specific types of tests the lab actually ran. You absolutely have to know the difference. Moving on to Section 2, the golden rule. This is the absolute core principle of molecular coding. And that rule is this. CPT code selection is all about the gene. I really want to let that sink in for a second. It is not about the patient's symptoms, and it is definitely not about what disease the doctor thinks the patient might have. It literally all comes down to one simple question. Which specific gene or genes did the lab analyze? The CPT manual relies on official gene names, so if you happen to see diseases listed in a code description in your book, just remember, those are purely examples to help guide you. They are not a restrictive list. Let's actually look at a clinical scenario to make this concrete. Say a provider suspects a patient has a genetic predisposition to breast cancer and orders a test. Now, the doctor is entirely focused on the why, that suspicion of breast cancer. But for us, the coders, our job is purely the what. Did the lab test the BRCA1 gene, or maybe BRCA2? Whatever you do, do not look up breast cancer in the molecular pathology index. You want to look up the exact gene that was analyzed. Leave the why to the doctor and focus completely on the what.
Let's keep rolling into Section 3, sequencing and modifiers. This is all about avoiding those common exam traps.
Listen up, because a massive exam trap is confusing targeted tests with full sequencing. Some tests only look for targeted variants. It's kind of like scanning a page just to find a few specific typos. But then we have full gene sequencing, which is often part of genomic sequencing procedures, or GSPs. That is way more intense. It's like reading the entire page or even the whole book top to bottom. You simply cannot code a targeted variant if the lab actually performed a full GSP. They are totally different tests, and they live in completely different code ranges. Now, have you ever wondered what is actually packed into a single molecular pathology code? Well, it's the whole package deal. One code bundles the entire technical lab process together. We're talking about breaking open the cells, extracting the DNA, prepping the sample, and actually detecting the gene. You never unbundle and code these individual steps separately. Much like multi-analyte assays with algorithmic analyses, or MAAAs for short, rely on their own specific bundled criteria, standard molecular codes give you the complete technical procedure all in one shot. But hey, what happens when the work is split up? Here is a super helpful tip for exam day. If a provider is only interpreting the results of a test that somebody else performed, and they're really just writing up the report, you are going to want to append modifier 26. This modifier elegantly separates the doctor's brain work from the lab's hands-on technical work. It's a really simple concept, but it is absolutely critical for nailing those tricky exam questions. All right, Section 4, Essential Pathology Vocabulary. Let's practice speaking the language of lab reports. First up on our vocab list is allele. I know, it sounds super complicated, but it's really not. If you think of a gene as a general recipe for eye color, the different alleles are just the specific instructions for blue eyes, brown eyes, or green eyes. It's just a variation within a gene. Just keep it that simple in your head and you'll be totally fine. Next, we have the copy number variant, or CNV. Contrast this with those tiny little changes or typos we talked about earlier. A CNV is a major big picture change. This happens when a whole massive chunk of DNA is either missing completely or it's been duplicated. So basically, the patient either has way too much of that specific genetic information or way too little. And this is a really vital distinction because, frankly, not all genetic variants are created equal. When a report says mutation, it means a variant is pathogenic, meaning it's definitely known to cause disease. But on the other hand, you have a polymorphism, which is just a common, perfectly harmless variant. If a lab report only mentions a benign polymorphism, it might totally change whether a specific diagnostic code is medically necessary compared to finding a pathogenic mutation. So knowing the difference between the two, absolutely huge. Which brings us to our final part, Section 5, the 3-step decision tree. This is exactly what to do when you come up empty-handed. Okay, grab a pen because here is your ultimate exam cheat sheet. Let's say you're looking at a clinical scenario with a lab report for some rare gene, let's call it XYZ. Step 1, check your Tier 1 codes. That's 81161 to 81383. Those are your most common gene-specific tests. If XYZ isn't there, no panic. Move to Step 2, Tier 2 codes from 81400 to 81408. These codes group the less common genes by complexity levels 1 through 9. Now, if you scour all 9 levels and XYZ still isn't listed, then and only then do you move to Step 3. Use the unlisted procedure code 81479. If you just follow this strict hierarchy, you will literally never get lost. So to quickly recap your exam cheat sheet, always code the exact gene, not the disease. Keep a sharp eye out for full genomic sequencing procedures versus targeted variants. Remember what's bundled into the technical process, and always follow that Tier 1 to Tier 2 to unlisted pipeline. You now have the decoder's key to tackle the stuff. But before we wrap up, I've got a question for you. What is your biggest challenge right now with pathology and laboratory coding? Let us know down below. Keep practicing those codes, and I'll catch you in the next explainer.